Right, well, UNAIDS has urged, world leaders to act with courage to end AIDS. This came up at the 2022 AIDS conference in Montreal. The new UNAIDS report released at the conference shows how the AIDS response has been blown off course, making action urgent. The research presented at the conference provided a new data, important scientific progress, and further evidence on the biomedical, social, and policy interventions needed to stop the AIDS pandemic. The conference also highlighted a breakthrough, a new long-acting ARV to stop HIV. New research showed that injectable PrEP is among the most effective tools for preventing HIV available, and that it works well in multiple populations. Let's take this discussion further then. We are now joined via Zoom by Scott McQuade, who is a Senior Advisor, Management and Advocacy at UNAIDS South Africa. Thanks very much for joining us on the show, Scott. A warm welcome to you.
Thank you.
Let's talk about the conference itself. I mean, the new UNAIDS report showed at this particular conference that the AIDS response has been blown off course. Let's talk about the reasons given for this, why it has been blown off course. A lot has been blamed on the fact that we were also not dealing with the AIDS pandemic, which of course we've had for many, many years, but that then there was the introduction of the COVID pandemic, and one wonders if the two together seem to cause a problem for the response to AIDS.
Yes, thank you. Certainly COVID, we all know, has been a considerable effect around the world. We saw that health systems in particular need to be strengthened because they were diverted significantly by this new pandemic. The focus of everybody was to treat COVID, and unfortunately a lot of people who would have turned up for regular HIV services either were scared to go out or couldn't go out, or were deterred by the risks that they might have faced. There was a lot of uncertainty in the early days of COVID around this. Things are gradually getting back, but we need significant courage and investment and support to get back on track.
Yeah. And we're talking about the research which was presented at the conference. There was an important scientific progress that was shown. Let's talk about this particular progress. I understand that there's been some breakthroughs in the meantime. What breakthroughs are we talking about?
Well, trials have shown the effectiveness of the injectable PrEP, or pre-exposure prophylaxis. It's a preventive medicine. It's essentially the same medicine that's being used in treatment. But when used, and it's been around for more than a decade now, in oral form. So you can take a tablet, and depending on the type of activities, the specific risk that you face, it can prevent, and what we're calling U equals U. If you continue to take treatment to the point that your viral load is undetectable, then you cannot transmit. In the same way, the same drug, essentially, when taken orally, can prevent you becoming newly infected with HIV, and thus also now in an injectable form, you can have an injection every 2 months, possibly every 3. That would certainly save a lot of effort in terms of taking medicine on a regular basis, or having to go back to a clinic to get further prescriptions.
Yeah. UNAIDS has been urging world leaders to act with courage to end AIDS. When you say that, what do you mean? Have world leaders not acted with courage when it comes to addressing AIDS? What courage do you want them to display when you say that world leaders must act with courage?
Well, certainly it's clear that the investment in HIV is not only significant in terms of the scale, but it pays back. It's cheaper to prevent new infections than it is to put people on treatment for the rest of their lives. And in terms of ensuring that productivity and so forth, the financial case is there for HIV. And also, we need to address many issues that hold back the AIDS response. So we're talking about issues of violence, poverty, unemployment, education, keeping girls in school.
Yeah.
In certain countries, they have punitive approaches to legislation. For example, they outlaw gay and other men who have sex with men. And so you sideline populations to the extent that people are not turning to clinics for the help that they need to ensure that they remain free of HIV, or if they're HIV positive, that they go on treatment and suppress the viral load so it doesn't spread further. So we need governments to be courageous in terms of stepping up for not only for the investment, but matching the targets that they'd already agreed to last year, and ensuring that their society moves along in a way that we adopt harm reduction strategies based around the health of populations, rather than simply using tools like legislation to punish people who might not behave in the way that most people expect.
All right, moving forward then from the conference, where to from here? You know, we have these amazing conferences where great feedback is given, but, you know, when it comes to actually then, you know, using what came out of the conference going forward, that's always sort of the challenge, I assume. So where to from here then?
Well, there are a couple of key initiatives that South Africa signed up to, and you'll know that the Minister of Health, Dr. Joe Phala, led the delegation for South Africa to this conference, and he participated in the launch of these two initiatives that are particularly of interest. One is just get the wording right here, a new global alliance for ending HIV in children, and there was also a global HIV prevention roadmap launched. So these lay out some of the bold actions that are needed to move this forward, and the health minister gave his very strong commitment for South Africa to these initiatives. He also indicated very strong support for addressing HIV risk among adolescent girls and young women. It's particularly high here. 1/3 almost of all new infections here in South Africa last year were amongst adolescent girls and young women, even though they make up only 11% of the adult population. So there's plenty of work to do. There's also a new national strategic plan on HIV to be developed currently. So by next year, that will be in place, taking us through to 2030, and which is the Sustainable Development Goal of ending AIDS as a threat to global health at that time. So there are quite a number of initiatives here to recover from the impact of COVID, and also to meet those aggressive targets.
All right. It's been a pleasure having you on the show. Thanks very much for speaking to us. That is Scott McQuade. He's a Senior Advisor, Management and Advocacy at UNAIDS South Africa. Thank you, sir.